Only on WRAL, we are finally hearing from the CEO of a troubled mental health hospital that we have been talking about for months. This comes just days after Holly Hill announced a new collaboration with Raleigh police that would mean patients bypass the emergency room and go directly to their facility instead. WRAL investigates Sarah Kruger talked to the chief and the CEO at Holly Hill. She joins us now. Sarah, what did we learn?
Gerald, I had a lot of questions that I wanted to ask the chief given all of our reporting, and I did have the chance to do that. My interview with the CEO, though, was unusual. She was very hesitant to talk to me, as you're about to see.
Just 2 days ago, this news release came as a big surprise, a new collaboration between Holly Hill Hospital and Raleigh Police. We asked for an interview with Raleigh's police chief, who explained Holly Hill's CEO approached her with this idea a couple months ago as a way to reduce strain on emergency rooms.
But also to get that critical care that the consumer needs.
Have you seen our reporting on Holly Hill?
I have not seen the reporting. I have heard about the reporting, but I have not seen it.
Over months, WRAL Investigates has spoken with more than 70 former patients, parents, staff, and executives of Holly Hill. We heard complaints about never seeing a doctor, not getting proper treatment, over-medication, sexual abuse, understaffing, and falsifying records. State investigators cited Holly Hill with multiple violations.
Does that give you pause in partnering with them?
It does not, because the reason being is we have new leadership in place.
That new leader is CEO Lee Holston. What we didn't know when we went to meet Chief Patterson is that Holston would be there too. She initially said she would do an interview, then suggested I email questions instead. I pushed back, and she finally agreed only to let us record audio.
Why have you not wanted to, and still do not want to, do a full on-camera interview?
Well, in the work that we do, of course, we have to be very careful about the privacy rights of the patients and population we serve.
Holston says she started in March and can't speak to past issues. So I asked her about the 5 teens who escaped right after she took over.
There's always opportunities for improvement. And that's what we're doing.
And you guys step up in a big way, so we thank you for that.
Outside our interview site, this service fair was happening, hosted by Acorns, the mental health unit within RPD that Chief Patterson says will be instrumental in the new collaboration. Patterson says people in distress need somewhere to get care.
And if Holly Hill is able to provide that, that's a win for the entire community.
And what if they are not able to provide that? Are you open to that possibility?
Well, certainly we will assess and see how things go.
This new collaboration will be for adult and juvenile patients. I asked the chief if city leaders had to sign off on this. She said they did not. She said they've been working with Holly Hill for years, and this is just one new way to partner. Deborah.
Thank you, Sarah.